More news coming in. Another suspected Nipah virus death in Kerala, where a 57-year-old man from Palakkad has died on the 12th of July, due to Nipah. Kerala government is ramping up contact tracing and surveillance, which are the key really to all of this. Kerala government says avoid unnecessary hospital visits, avoid visiting relatives at hospitals. That is absolutely unnecessary. Remember, given how quickly it spreads. Avoid unnecessary visits to hospitals, especially in Malappuram and in Palakkad. Visiting relatives and friends who are undergoing treatment in hospitals should be avoided. Shibi Mall is with us for the very latest. Shibi, this is in fact, an annual occurrence here, the scourge of Nipah virus really where, the fatality rate is very, very high, and it's of utmost concern that there are 6 districts under alert. Talk to us about the kind of precautions that is being taken. Going back to Shibi in a moment from now, we're telling our viewers about how a 57-year-old man from Palakkad is the latest to succumb to the Nipah virus. It's a suspicion that he was infected. This has prompted the government to ramp up contact tracing and also field level surveillance, which is the key essentially in a situation where the virus spreads, infection rates are high, and also fatality rates in Nipah virus continues to be very, very high. Shibi Mole is back with us. Shibi, this is highly contagious and the fatality rate of Nipah virus is also very high, isn't it? Given that, having said that, talk to us about the precautions that the government is taking, given that this really is an annual occurrence this time of the year, isn't it?
Well, exactly, Sneha.
Yes.
In fact, this is the main fruit season, and once the season is over is when we usually find, the rise of Nipah virus. We have seen earlier in 2018 and 2019 when Kerala went through a major crisis with Nipah virus, with many people losing their lives. Later, in 2022 and 2023, we again saw Nipah outbreaks in Kerala, but that was not as severe as 2018 and 2019. Again, we are seeing 2 deaths reported in Kerala in this year itself, and it's a very, serious situation. The government has put an alert in 6 districts of Kerala. That includes Thrissur, Wayanad, Kozhikode, Kannur, Malappuram and Kasargod. Now, these are the 6 districts in the northern part of Kerala. So that is where they have been put on high alert, especially in all the hospitals. Only one person with the patient is allowed to be in hospitals. No unnecessary visits are allowed in the hospitals. They have, they have made a contact list of the person who's tested positive for Nipah virus, who passed away on Saturday. So his contact list has been prepared. There are many health workers also in the contact list, many health workers also in high-risk category. So that is definitely a major concern. Masks are compulsory, especially for people living in these particular districts where Nipah virus has been reported, and also in these districts where an alert has been issued. And avoid as many hospital visits as possible. That's the main point the government is mentioning. Do not go to hospitals if at all, if it's not necessary, unless and until it's absolutely necessary is what the main instruction is. And also in the designated areas, in certain panchayats, there's masks have been made compulsory, and also there is restriction as far as movement is concerned. So now that is the main, guidelines issued by the government, and stay on alert. And any symptoms, any fever symptoms, should also be reported, because the death that took place on Saturday was a fever case. He passed away after after being infected with, reporting fever, and later only after he passed away there was doubts regarding his symptoms, and then once his samples were sent for Nipah, it tested positive. So even if there is a fever symptom, that should also be reported to the government and to the health officials, considering that there is a high risk factor existing currently, especially in this season, especially in the coming months. We need to be very careful, is what the government is saying.
All right, it's important that you pointed out, Shibi, that even if there is fever, it should be reported, is the word really from the government. It can go a long way in ensuring that the virus doesn't become fatal, given that the fatality rate of Nipah virus, viewers, is very, very high, up to 60% plus. Highly contagious. It's a deadly zoonotic pathogen. Shibi, I'm going to leave it at that for the moment.